Hello, my name is Shirley Breath, and today I'm going to present the roles and responsibilities of a nurse educator. First off, I feel a great responsibility to my profession as I continue on this adventure. And I say adventure because that's truly what it's been as I've gone from the role of bedside nurse to the role of nurse educator. The role of the bedside nurse, as far as education goes, is in teaching the patient and family members about their health, about disease processes, and perhaps medication administration. In the role of nurse educator, we are now responsible in the formation of a student to a nurse. It's like becoming a new parent again and accepting the responsibilities of teaching your child the basics of life. As nurse educators, we accept the responsibility of teaching the basics of nursing to new nursing students. Before entering the classroom, it is important that the new nurse educator understand the roles and responsibilities. Of the many roles we play in our lives and careers, the role of nurse educator is most esteemed. Earlier this year, the school that I work at received its HLC accreditation. The Higher Learning Commission accreditation is extremely important as it allows graduates of this technical college to take their credit hours and move them on to other colleges or universities to complete their education. During the process, the practical nurse department was responsible in completing a program review and making sure that it was aligned with the mission and vision and values of the college. To do this, we based our curriculum on the NLN core competencies. As discussed in Chapter 1 of Billings and Halstead, Fink said it is crucial that competencies are followed when creating faculty development for nursing in the nursing department. The department must work together to follow the competencies set forth by the NLN and the expectations of the college as related to its vision and mission. At the college in which I teach, service and faculty governance are held in high esteem. The PN department is always represented in the Leadership Council and plays an active role in the decisions that are made. In Billings and Halstead, Chapter 1, Fink used references from Balsmeyer et al., Chowdhury, and Davis et al. When discussing the importance of nursing faculty to be involved in service and faculty governance. The president of the college often compliments the nurse representative for speaking up and giving a voice of a different perspective in these meetings. Another role of the nurse educator is in the clinical setting. Many times, the nurse educator that teaches online, hybrid, or face-to-face does not step into the role of the clinical instructor. In Chapter 23 of Bradshaw and Lowenstein, Bradshaw tells us that this role puts the nurse educator in a clinical setting with a group of students, and depending upon the teaching philosophy and style, the nurse educator develops the clinical side of their teaching. As in the classroom, the nurse educator's teaching style will develop itself and evolve into the clinical style. As described, there are many teaching styles that evolve out of clinical teaching. In Scholarship Reconsidered, Ernest Boyer discussed the scholarship of teaching. He stated, "Those who teach must above all be well informed and steeped in the knowledge of their fields." This is especially important because if students do not believe what their instructor is saying, trust is lost, and then thus learning will not be accomplished. As you can see, the role of the nurse educator is varied and complex. The nurse that chooses to become a nurse educator must have excellent skills, communication skills, and be able to switch roles as easily as changing a hat, as a clinical setting may develop from one of teaching a student what to listen for when a patient has a heart murmur to a code at the drop of a hat. And it is a nurse educator and student that are at the bedside. And the nursing skills kick in, and the nursing cap is back on the nurse educator once again. Thank you.